for privacy, wash my hands, I'll wear PPE, so I'm gonna put my gloves on. Hi, I'm Ashley, I'm your student nurse today. I have orders to give you normal saline in your IV. Can I have your first name, your last name, and your date of birth?
Mackenzie Fitzgerald, 12496.
And do you have any allergies?
Nope.
Okay. So the first thing I want to do is I'm going to make sure that I have all my supplies, that I have my normal saline, that I have my tubing, that I have my tape, and let's see, and my flush. And then I have my doctor's orders. So I have all my supplies here. And then I want to make sure that everything is intact. I've already practiced that this is open, but it wouldn't be. So everything is good, it's intact, nothing is expired. So I'm going to come look at the arm. So I'm going to look at the IV site, make sure that there's no signs of phlebitis, which would be inflammation or redness, which I don't see. And then I'm also going to look on the arm, the expiration date here, because we can only hold it for 96 hours. So it's fine, it's not expired. So I can go ahead and I can give this. So I have my calculations for the drip rate of how much I'm going to give. So it'll be 100 milliliters every hour, and then it'll be 25 drips per minute. Otherwise, you can divide that by 4, and it would be 6 drips per 15 seconds. And that's my calculation there. So what I want to do first is I want to compare my medications to my MAR. And I'm going to do 3 checks of this before I even give it to my patient. So I want to name the 5 right, or the rice. So it'd be right patient, right dose, right route, right time, and right documentation. So I can go ahead and I'm going to look at this. So again, I'm pretending that it hasn't been opened. I'm looking into it. So 1,000 milliliters of normal saline over 10 hours, which is correct. And then 0.9% sodium chloride 10 milliliter fill. Good. So then, let's see. I'm going to go ahead and I'm going to look again and do my second check. So 1,000 milliliters normal saline over 10 hours, and then 0.9% sodium chloride over 10 milliliters of flush. So that's good to go. And then I also want to, for my third check, make sure that I check that again one more time before I give that to my patient, so that I have the correct patient and everything, so I can go ahead before I even open that up. So this time I'm gonna be like, yep, okay, 1,000 milliliters over 10 hours, and then I have 0.9% sodium chloride, 10 milliliter flush. Now I can go ahead and I can open up my packaging, because all my checks are done. I have the correct patient, and I have the correct medication. So I'm going to open up my tubing. Again, I've checked expiration dates and they're all fine, and I've checked packaging and they're all fine. And I've checked my arm expiration date to make sure that it hasn't been over 96 hours, and it hasn't been. So when you take the tubing out of the package, you want to first close the clamp. So this is on the bigger end, that's open, and if you push all the way down, that's closing it. If you have it open, you're just gonna have a mess. So close that. I'm gonna take this tip off, throw that tip away. You're gonna open up this blue tip, you throw that away, and then you wanna spike your bag. So it's kind of a pain to get it on, but you just gotta push and twist it on there. Okay, remember, have it clamped. Hang your bag. And then you want to hold all of your ports upside down. Fill this halfway, Phil.
At least that one put their names on it.
That. And then you can go ahead and you can open up your port and let everything flush.
So I'm gonna show you what I have.
Can you pause? Actually. Just going very slow. It's all the way up. There we go. So I've got some dripping now. Close that up. And then you can straighten this out and then try to get your bubbles out. And if you need to let more drip out to get the air bubbles out, you can. And then try to flick your air bubbles out. Okay, and it's full. Make sure that that's clamped and shut. I'm gonna make sure that this is also clamped and shut. Okay, next you wanna take an alcohol wipe. Pull that out. And then you wanna clean your port for 30 seconds. Okay, and it's been 30 seconds. Then you wanna take your push fluid here, put it on, and twist it. And before you do that, again, before you do that, push up to get rid of those air bubbles. Okay, that's clean, don't let it touch the arm. Pull back and aspirate for blood. And I got blood. And then you're gonna do the little pushes. That's gonna let all this fluid circulate. Okay, twist that off. When you're done with that, then you can take this cover off. Again, don't touch anything. Clamp these together. Okay, that's unclamped. Then what I want to do next is I want to take some tape. Just gonna stick to my gloves, but it's okay. Oh my gosh. Take your tape, tape it on the arm so it doesn't move. You're gonna put your put the date and sign it with your initials that you did it. So the next person that comes in and does it knows when last time it was done. And then we have to take our drip medication, our drip dose. So 6 drips per 15 seconds. So I'm gonna go ahead and I'm gonna start that.
And then I'm gonna make sure that, I orders for my normal ceiling stuff, I just put it out every 8 hours. And then I'm looking at that, I believe it's not the Mars, it was, I show you that.
15 seconds. So now I know it's all good to go. And then you want to make sure that you throw all of your supplies away in the garbage that you don't need. I'm just going to leave that there. Take off my gloves. While I'm here, is there anything else I can do for you?
No.
Okay, and I would go document and record, and I'm done.
Okay.